All right, looks like it's noon. Welcome everyone who is here, and welcome to our Experts Live series run by the College of Arts and Sciences at UVM, featuring faculty speaking on topics related to the COVID-19 crisis. My name is Sophia Trigg, and I work in the College of Arts and Sciences Dean's Office, and today I'm happy to introduce our speaker, Ilyse Morgenstein Fuerst, Associate Professor of Religion and Associate Director of the UVM Humanities Center. Today's talk will focus on religion during the time of COVID-19 and will run about an hour, including question time. So if you have a question, please go ahead and type it into the Q&A box on your screen. And just so you know, you will only be able to see your own questions until some are starting to be answered. So don't worry if you don't see any other questions popping up. Just go ahead and put anything that you think of in that box and we will see it. We are recording this session, so it will be available on our Experts Live webpage after the fact, so please share widely. Without further ado, please welcome Professor Ilyse Morgenstein Fuerst.
Hi, everybody. That's better. I'm so glad to be here with you. My mouse got stuck, so life in the time of COVID means technological joy. Let's say that. So like Sophia said, I'm a professor in the religion department. I also am the associate director of the Humanities Center, and I'm going to talk us through why we should be paying attention to the way that religion as a phenomena that we study and religions as individual institutions and religious people are things that we should think about when we're thinking about a global pandemic. So I'm going to flip over to a PowerPoint presentation and talk over it with you, and then I will bring my face back for the end for Q&A. Okay, so we are going to talk through religion in the time of COVID-19. So I want to start by saying what I'm going to talk about. I think much in the way that I run my class sessions, I want to make sure that everybody has a sense of what our roadmap is. So I am going to say, yep, religion is important, even if you yourself are not religious, even if you find religions to be dogmatic. Oh, I have not shared my PowerPoint. Let me try that share button again, everybody. Did it work that time? Okay. Let's try one more thing. Sorry, y'all. Thank you for your patience. How about now? Okay, so I want to restate that we are I'm going to talk about that religion is important even if you're not religious. We'll talk through how religious institutions and communities are responding to the pandemic. And we will talk through just for a second about why Christian extremism matters in this moment. So I know other sessions within the Experts Live, CAS, programming are going to talk through the science of it, and perhaps some will get into how the science is being ignored. But for me and for scholars of religion, part of that answer is actually about Christian and white Christian extremism. So some assumptions about religion to get us going. I think a lot of folks assume that religion is for religious people, that religion is a private matter, and that religions are inflexible. So a lot of times one of the best things I hear about the job I do is, oh, we can't talk about that in polite company. But on the other hand, the facts are that religion is just an area of study, and its phenomena affect all of us, whether or not we're religious. So whether we think we care about religion doesn't mean that religion as an institution and as a system isn't enacting power on our bodies and in our communities. But also religions are made up of people. So if people are inflexible sometimes and flexible at other times, then so too are religions. So the spoiler alert for this little chat is that we need to care about religion. We need to think about how religious institutions are structured and functioning. And we also need to think that if religion is made up of people, then whatever people might be capable of, so too are religions. I want to get into some specifics though. So I don't know that anyone else but me follows I don't know that anyone else but me follows the news around religion as closely. So I've got 3 images on this slide. The first in the center is the Pope at the Vatican on Easter Sunday. And I'm not sure if you are capable of seeing the background, but it is a completely empty St. Peter's Square, completely empty on Easter Sunday, which arguably is one of the most popular times to be there and at the Vatican and to hear the Pope give a blessing. But it's completely empty. And when the Pope stood there and gave his blessings for Easter Sunday, one of the things that he said was that he's not just blessing the square and the non-existent people there, but rather the whole world. So that instead of skipping the ritual, he did the ritual by blessing out the window, even though he's blessing an empty space. And then the religious innovation there is to say, I'm not blessing an empty space, I'm blessing the whole world. My blessings are not confined to this location. In the top right is an image of a Passover Seder just a couple weeks ago, a Jewish holiday also in the spring. And for many religious Jews, using technology is a question mark in religious ceremony. And yet for Seder, since you're supposed to gather with friends and leave your door open and have an open home for anyone who wants to come to the meal, Zoom Seders, or Zaders as the internet was calling them, became really popular as a way to connect with family, particularly elders in the community, who might be doubly homebound given the risks that COVID-19 poses to older folks. So in that image, we see three young folks waving at 2 different Zoom screens, so 2 different families joining in. And on the bottom right, you see a picture of Mecca, the Kaaba in particular. So that black box is the Kaaba, which is in the holy city for Muslims of Mecca. And in February, the Saudi Arabian government canceled any pilgrimage to Mecca and Medina, the holiest sites for Muslims. And they are now considering canceling Hajj, which is the major season in which most Muslims would go on pilgrimage, completely. And so that image of the Kaaba with no one around it, as a scholar of Islam, is so startling to me, because regardless of the time of year, that is usually one of the most busy places ever. And certainly at a time where Muslims are gearing up for the holy month of Ramadan, which starts today or tomorrow, depending on your particular denominational affiliation and the customs of your community. To see these empty spaces really drives home that folks are having to make real changes about their expectations around religious practice, and that communities, institutions, and individuals are all either abiding by those choices or, as we'll see in a minute, not abiding by those choices. So one of the ways that we're seeing vast changes are in the 3 so-called Abrahamic religions, Christianity, Judaism, and Islam, making rule changes, I'll say, to what's allowed, like in the Passover example, but also what's expected. You should prioritize public health over communal visits. Just to keep talking about religious innovation, we're also seeing folks be really funny. So this is a Park Avenue church sign from New York City that's quoting Isaiah 1:16, "Wash yourselves and be clean," which is funny because we're all supposed to wash our hands and stay distant from each other. And so it's using Bible verses to make light of the situation, but also to send a message of where that church stands. On the top right image here, we've got even more innovation, another mosque. This one is in Qom, a city in Iran, which has been disproportionately affected by the pandemic, in part because of US sanctions on medicinal care. And so there you see a totally empty square with 2 people wearing face masks. But ahead of Ramadan, this kind of emptiness isn't what we would normally expect, especially in a bustling city. And on the bottom right, some of the other innovation that we're seeing is consistent with religious practice. So the Sikh community, that's S-I-K-H, not Sikh, that's not how we pronounce it actually, it's Sikh. So the Sikh community is well known for acts of seva or service. And one of those traditional acts of service is to feed anyone who needs it. And globally, we are seeing Sikh communities help the sick and the ill with these huge, what are called langar meals, these huge meals meant for anyone who needs them. So this particular image is from New York City just last week. And you can see that the folks in this image are all wearing protective gear, but are still producing lots of food. And depending on the Sikh Gurdwara or the Sikh organization, what I'm seeing nationally, at least in the United States, is Sikh folk packaging up like prepackaged meals and doing essentially curbside delivery for folks in need, and doing delivery services. So this would vary widely based on the individual house of worship, because unlike Catholics, Muslims, Jews, and Sikhs do not have an overarching head of the church, so to speak. So it's not as if some head person is commanding someone else to do these service meals. This is simply part of the tradition that's being altered to meet the current needs of the community. So I want to wrap up what I mean on institution, community, and individual. So what I tried to show you in those images is that there's religious innovation happening across the board. I've been using the word institutional. In some ways, I'm meaning like the institution of states. So many states, including Vermont, where I'm located and where many of you are located, states have barred gatherings altogether, right? So we have had to see religious institutions comply with those laws. But we've also seen religious institutions themselves, so not the state, but religious institutions like Catholic dioceses, like Protestant denominational governing boards, like the Reformed Judaism Association of Rabbis, like Muslim leaders around the country, right? So institutions that are meant to speak broadly for more than just one particular church or one particular mosque, issuing statements of how they'll manage things like death and burial, things like these major holidays happening all in this season. Then we're seeing community responses. So informal and local changes that are happening in response to the pandemic. Some of that looks like the seva meal of the Sikh community in New York City. Some of that looks like the Baptist churches, the Methodist churches silly sign about Isaiah. Some of that looks like individual rabbis making it acceptable to use Zoom and therefore electricity after sunset on Shabbat so that folks can actually say the prayers on Shabbat. So prioritizing individual rituals over broadly held customs has been, in some cases, an institutional decision, but in other cases, a community-based decision. And then we're seeing individual responses too, of course, right? So you and I as individuals make choices. We might choose to participate in a Zoom Seder, or we might choose not to. In states where we're seeing religious institutions offer no guidance or offer guidance that is against medical advice, it has been up to individuals to decide whether or not that feels safe. So for example, the Eastern Orthodox Diocese of Australia said early on in the pandemic, about a month ago, 2 months ago, that the way in which folks take rites is through one shared communal spoon, and that was fine, that we were going to keep sharing this one spoon to essentially take communion because the spoon was exempt from germ theory, essentially, that God would protect us and this wasn't subject to those kinds of rules. And so they weren't going to change that ritual. Now, if your institution is saying that, then you as an individual need to make the choice of whether or not that makes sense to you and whether or not you want to participate in that particular practice. I want to take a few minutes, just a few, and then I want to talk more about why we care about religion and why I think we all should be paying attention to religious responses, to talk through anti-science movements, white Christian extremism, and the global pandemic. There is a particular and particularly American religious response that we're seeing. And really in the past day or so, it has been something that I have found impossible to ignore in my various news feeds, whether that's online or on TV or on the radio, around folks doing the open the economy protests, making arguments around the fact that churches being closed is a threat and a violation of religious freedom and or the First Amendment. And we've seen governors suggest that churches in some places are quote unquote essential. And so therefore keeping churches open and allowing folks to sit in pews are essential. We've also seen anti-Muslim rhetoric around the unfairness of churches being closed, but with Ramadan coming up, there's been a lot of Twitter action and the president of the United States retweeting a number of these tweets about wanting to see whether or not Muslims would be held to the same standard and using the upcoming Muslim Holy Month as an excuse to sort of demonstrate a certain ideology wherein Christians are a beleaguered minority in the US. I want to say for the record that that is absolutely factually inaccurate and that hate speech is what it is. It is hate speech. There is a long history in this country of particularly white Christian Protestant strains that are where we get the word fundamentalism from, so have a particularly extreme view of science. And we're seeing that play out in real time. And so a lot of the requests that we're seeing around religious freedom, a lot of the lawsuits that are being threatened, I saw 3 so far, one in Mississippi, one in Arkansas, and one, I don't know if it actually went to a lawsuit, but there were rumors of it being sued in Texas. So I'm gonna pull back on that one. And in Alabama, there was one, a church threatening to sue that closing churches is discriminatory. The idea that God will protect us, or that there can be or might be a cleansing that happens, these are rooted in a very specific kind of American Protestantism. And I want to highlight that because I think when we think of things like religion is inflexible, or we're seeing these religious nuts go protest, or how come these religious people aren't listening? That is a real minority within a minority. And there is a racial politic, a Christian supremacy politic, and an American politic. We're not seeing the same kinds of reactions in other places in the world, even places that demographically look a little bit similar to us, like in the UK or Australia. So I'm happy to answer more questions about that. I'm also happy to refer you to lots of resources. I'm a professor after all. I've got a bibliography a mile long. But when we're thinking about religious inflexibility or a particularly anti-scientific view, I want to make sure that we're naming the culprits of that view loudly, and then talking about the vast majority of religious organizations, institutions, and individuals that are responding with the public health, with medical advice, and with science on their side. So before I wrap up and then open it up to questions, I want to just restate why I think this stuff matters. When we're talking about religious change, it's easy for me, and it was easy for me to find pictures, right? Like this is a visual medium, so I needed to find ways to describe to you what I was talking about. It's easy to find things like the Pope preaching to an empty square, or an empty Kaaba and Mecca, or a Zoom Seder. But one of the ways that this affects all of us are in sort of the grim realities of a pandemic that has to date, and by what I understand, claimed over 40,000 lives in the US. We have cemeteries, burial rituals, crematoriums, death certificates, all of these things that in the US are inextricable from religious institutions. How we mourn our the victims of this pandemic has a lot of religious resonance for people. So for Jews and Muslims, being able to bury the body usually within 24 to 48 hours, what does that look like in a city like New York that doesn't have the capacity to make that happen? What kinds of religious innovation needs to happen to make that okay with the survivors? What kinds of processes of grief and grieving are available to people when you can't hug your sister or your mother or your child if they're a young adult? So I'm not trying to end on a really dire note, but I do want us to think about where religion might pop up for us in our individual lives, even if we are ourselves not already thinking about how to manage an iftar dinner during Ramadan while we are also in social isolation. The other way I think religion is showing up is in the ways that folks are framing ethical conversations right now. Is it ethical to go out without a mask? Is it ethical to underpay and undervalue essential workers like supermarket staff? Is it ethical to close? What is the greater good? Do we close the farmers markets, or do we provide avenues for making sure farms and farmers have financial ways to make money, and also that we have access to food? Now, it is reasonable that you're saying, oh, please, Ilyse, ethics are a philosophical issue and they're deeply secular. To which I say, ha ha ha, maybe you think that. But in the United States, ethics and morality have always been deeply intertwined at the state, the institutional, the local, and the individual level to specifically white Christianities, but also to monotheism. So the way that we're seeing folks say the economy is more valuable than saving lives, what is the greater of two evils? The overwhelming response I'm seeing to that is not, let's make a philosophical secular argument. It is instead jokes like, where's the pro-life movement now? Or my religion doesn't say that. Or memes of what is true in Judaism and Islam, this phrase of to save one life is to save all of humanity. So I think religion, like I say in my classes anyway, religion is lurking in the floorboards. And in a moment of deep crisis, religion is often a place that people turn to for comfort. But that looks really different now if we need to be isolated and distant from each other. And religion becomes a fallback for the way we think about ethical and moral decisions. Okay, with that, I think I'm going to open it up for questions so that we have plenty of time to go back and forth. Let's make sure I figure out how to do that. I think I did. I think I'm back on the screen. Okay. Okay, so I see a question from Richard that said his mom is a Quaker and that that her church or friends meeting house is seeing attendance higher than it's ever been. And what are we seeing more participation in religious activities and the technological uses? Okay, so it's a great question, Richard. I would say that what I'm seeing so far, and these things are unfolding in real time, so please don't quote me on numbers and statistics or ask for numbers and statistics. But what I can say is a lot of folks are anecdotally reporting that we're seeing higher attendance in some ways and less engagement in others. So we're seeing higher attendance in the zooming into a Sunday morning Quaker meeting or a Friday night Shabbat service, but we're seeing less engagement in ways like the food drives that a religious organization might have, or the long-term planning for a religious institution. So Anthea Butler, a scholar of religion based at Penn, a really eminent scholar of Christianity and African American studies, made a quip in a piece the other day that we're seeing people come back to faith because there are no atheists in foxholes. And so her sense was that there's a bump right now, but it might be for boredom and it might be out of fear. It's a great question, though, and I think researchers are really thinking critically about what comes next.
I have a question, Ilyse, if you don't mind.
Yeah, go ahead.
So this is Sophia again. Hello, everyone. Just a question about, historically, do we usually see people moving toward religion after these mass crises, or are people kind of abandoning religion after this, having seen how much death and et cetera that it brings?
It's a really great question, Sophia, so thanks for it. I want to think about it a little bit. So I am going to ground my answer in the United States. My sense is that we actually see a shift. We see religious innovation more than we see a flocking to or a fleeing from religious organizations. So, for example, after World War II, we see a real resurgence of American liberal religion. So we see a lot of folks after the Great Depression, and after World War II, we see a lot of liberal kinds of ideas of religion, like feeding the poor becomes a number one focus. We see things like the WPA and the New Deal being a force for what we might call lefty politics today. They wouldn't have called it then, but we see folks organizing around the greater good and doing that in religious organizations and institutions, to say nothing of things like the civil rights movement. Now, on the flip side, in the United States, we often, when we see one kind of pendulum swing, we often see the opposite to be true as well. In terms of like butts in seats, how many people are in the pews, it's not clear to me that we'll know that, especially because the way we count religious participation often is weird, because we only count it based on attendance rather than and memberships to churches and synagogues, but we don't count it in like, no one's sitting with like one of those umpire clickers, like when people are walking in and out of a synagogue, they're not like kind of clicking it. I'm curious to see what things like mass death and also the response of people that are supposedly religious leaders. I think we're seeing a lot of what I'm seeing in Christian leftist circles right now is a lot of anger at more right-wing Christian understandings of like, open the economy, who cares what the cost is. And so I'm curious to see if we'll see a resurgence of a religious left within Christianity. So I see a question from Eliana that she says, COVID does not see race or religion, but can I expose to how COVID exposes racialization, marginalization of certain religions? And she's thinking about what's happening to Muslim folks in India. So wait, I have to publish that. Sorry, I'm talking out loud because I don't know how to work this thing. Yeah, it's baloney that COVID doesn't see race or religion. Of course, okay, let me backtrack. Of course, COVID doesn't see race or religion. It is a virus. To my knowledge of epidemiology, viruses do not have eyes. And so they cannot say, I am choosing this person as opposed to another. That said, that COVID's victims are overwhelmingly Black, and that Black folks are overwhelmingly getting different kinds of care in this country is absolutely about race, racialization, and marginalization. So we know that our system and our institutions are racist, and we know that they are classist, and we know that they are sexist. And so in a crisis, those cracks become canyons, and things that were canyons become, I don't know, something bigger than a canyon, a gigantic crater. I think that what we're seeing with Muslim folks in India in particular, for my research is based in India. My area of expertise is Islam in India. And what I'm seeing is reports that hospitals are denying care to Muslims. We're seeing tests rolled out in neighborhoods that are historically and in segregated ways Hindu as opposed to Muslim. In Delhi, just a few months ago, we saw anti-Muslim pogroms. And so we're also seeing Muslims in places like Delhi really reluctant to go to state-run facilities for care in light of this extreme violence that happened really just a few months back in January and early February. So I think how COVID exposes racialization is in this lopsided way. If COVID didn't see race or marginalization, then we might see we would expect to see proportionally folks being affected in the same way. The other way COVID is exposing marginalization, at least in the United States, is that essential workers, for the most part, are majority women. So things like service care, service work, like grocery store clerks, like essential retail, like nursing, these are gendered occupations. And things like home health aides, elder care, nursing are also raced. So we see more minoritized, so more Black and brown folks working in those lower paid jobs in the healthcare profession than in the more prestigious line of being doctors. And since those are the people on the front line, essential workers, we are seeing a disproportionate number of folks being exposed to those risks, as opposed to folks like me who get to work from home and have the privilege and the luxury to both be paid and to work in an isolated setting. So I hope that answers your question. It's a really good one, Eliana. I'll add, since I don't see a new question yet, I'll add, if it's interesting to anyone, that some of these innovations are, they feel like they're brand new. So for those of you who are familiar with Judaism, using electricity after the Sabbath isn't appropriate. You're not supposed to do that. Now, Jews do what they want, right? So individuals make choices and people are varied. And so we see Jews making different decisions. But we're also seeing the idea that we're drawing on historical sources in order to make new choices. So for this conversation around, can we use the computer to make Minion, to have enough people to run a service on a Friday night or a Saturday morning, what is the better? What's the good? Is it not holding the service because we're not allowed to be together, or is it holding the service in an albeit imperfect way using electricity, using technology? And from what I'm seeing, really from like really Orthodox Jews, so folks that might be more literal or interpreters, to folks that aren't, the benefit of having the ritual at all as seemingly outweighing not. And people are citing really historic texts like, what did we do in the pandemic of 1918? What did we do when electricity was invented? What did we do, etc. Similarly, around Muslims and canceling Hajj, which is a big deal, right? Like Hajj is one of the 5 pillars of Islam. You are meant to do it once in your life. And so if the Saudi government, so the secular government, ends up canceling the Hajj altogether this year, what does that mean for people who needed to do that to fulfill their religious obligation? And what I'm seeing Muslims do is sort of say, okay, well, we have all of this historical data of what people said during the plague. We have all this historical data of what people have said during other pandemics. So it's not just right here, right now, let's talk about public health or what we think we want to do. It's drawing on their own traditions, vast resources, because unfortunately, we have seen pandemics and we have seen global crises before. How did we do this before, and how can we alter that to do something different now? I think we have time for some more questions if anyone has any. I can answer questions about specific religions. Oh, wait, okay. Hi, Vicky. Vicky has more of a comment. And Vicky, I am guessing, is Vicky Brennan, fellow colleague in the religion department, who says that in Nigeria, after the 1819 Spanish flu pandemic, allowed Christianity to reach new communities in Nigeria that had already converted. So she's suggesting that there are historical precedents that say innovation as well as expansion in such contexts, which, thanks, Vicky. Professor Brennan is a scholar of Nigeria and Christianity there. So I did not know that. That's really helpful for me. And I also see Richard is asking, I'm curious what I'm doing. Oh, sorry. I have to publish a question for you to see it. My goodness. I'm curious what you're doing in my own teaching to engage this movement and my own use of technology. So I use technology a lot. I'm not someone who doesn't use technology. How am I engaging this with my teaching in this moment? Well, we're all teaching remotely, so a lot of my classes have changed drastically. Everything has been pared down because humans are people and this is stressful, and there's no reason whatsoever to act as if our students or ourselves are in a place to really carry the full burden of what we've done before. But one of the things I'm doing is I'm trying to talk about the pandemic as much as I can. So in my Islam class, we talked about Hajj being canceled, potentially, and Umrah, which is Hajj is a very particular time of a Muslim calendar. Umrah is anyone taking pilgrimage outside of that particular time. So we talked about how Umrah has been canceled, how Muslims are managing that. I'm talking with them about digital iftar. So what does it mean to break your fast at the end of a day of fasting while like on Zoom? Like, what does that do to your mental, emotional, spiritual health to like sit and eat, you know, your dates and your big meal on a computer screen in your jammies instead of in real clothing with your community, having made it through a whole day of fasting? We're also talking about, I teach a class on Islam and race, and we're talking a lot about the racialized effect of this pandemic and why a particular sense of anti-Blackness in every aspect of American society is really showing itself here, right? Like medical textbooks are telling, teach doctors and nurses and medical experts things like, you know someone's not getting enough air if they turn blue in the face. Lots of Black people don't turn blue in the face the way white folk do. And so even the diagnostic range of how we know to get care is itself based, it has racist history. So those are the things that we're talking about casually in my classes. I also host a podcast called Keeping It 101, and we've done a whole episode on the coronavirus and its impact on global religion, which is a lot longer than what I did for you all, but has a lot of the same kinds of themes, digs a little deeper into some of the innovations we're seeing globally and with a lot more examples. One of the examples I quite like is that for Muslims, the call to prayer, so the literal call to prayer that calls Muslims to pray either 5 or 3 times a day, depending on your denomination, usually says like, hey, everybody, it's time to pray. Hasten to the prayer. Come join us at the mosque. Come pray. And I'm paraphrasing. In a lot of Muslim majority places that have a call to prayer that it's changed. It's saying something like, hey, everybody, it's time to pray. Stay home and pray. Stay home. So we're seeing really like subtle changes. But if you're someone who's grown up with the call to prayer in your ears 5 times a day, those subtle changes wouldn't feel subtle at all. They'd actually feel quite stark. Thank you for that. Well, if we don't have any more questions, Sophia, do you think that we are
Yeah.
good?
So I actually have something to add too. No, I typed it in the chat so you didn't see it. And I was just thinking about how it's also important to think about how poorer people may not have access to technology and Zoom, and therefore may be cut off from communities and mental health support even if they use the religious communities for that. So it's just a thought I had while you were speaking.
Yeah, absolutely. And that's a struggle we have here in Vermont, and I know across the country, with access to high-speed internet, who has access, who doesn't. And then what churches and communities can do their worship practice, guidance, chaplaincy remotely, and whose traditions need those things to happen in person. Good point.
Definitely. Well, thank you. Thank you so much for coming on and doing this talk. I think it's really important that we hear from people from all across the humanities spectrum about this crisis. And I'm just going to say a few words now about next week so that you all know what's coming up. Next week, we're going to be hearing from Carolyn Beer, a professor of political science at UVM. And her topic will be Latin America, the Mexico-US border, and COVID-19. And that'll be next Thursday, April 30th at noon here on Teams. The link for that will be on the UVM Experts Live website, which is on your screen now, but also in the Facebook events. The link will be posted in that Facebook event, so you can just click through from there. Thank you all for coming and attending and asking your thoughtful questions, and we hope to see you next week. Enjoy this sunny day if you're in Vermont or wherever else you are, and stay healthy, stay safe, and we'll see you all next week.
Okay.